The Nigerian government has declared a state of emergency in the health sector. This was highlighted at the 64th National Council on Health, which was held in Ekiti State. Coordinating Minister for Health and Social Welfare, Muhammed Ali Pate, says the nation's health facilities are in bad shape, adding that there is a need for urgent intervention. Last month, the House of Representatives called on governments to declare a state of emergency in the sector and allocate significant votes to it in the 2024 budget. Now, joining me to further discuss this is Dr. Bright Oris-Ohwerhi, is a medical doctor. Dr. Bright, it's nice to have you around.
Thank you very much for having me.
So let's start by helping us understand, how would you describe the current state of Nigeria's health facilities?
I don't think we have a very serious health structure system in Nigeria. So if you're asking how to describe Nigeria's current health facilities, I believe you're referring to government-run facilities. It's abysmal. It's in complete shambles. It's in chaos, both personnel-wise, availability of necessary equipment, the manpower, both human and non-human resources. They are not available in these hospitals. And it has been like this for a while, which is why it's striking and interesting that lawmakers and politicians are calling for declaring state of emergency on health. It feels very disingenuous of them to be calling for emergency of health. We've had a health crisis for over 20 years in Nigeria that has, gotten worse, by each year with each coming government. So I don't know why they are calling for emergency in health. What emergency in health? We have been in a serious emergency for over 20 years. So what are they saying? That there's an emergency in health. We're in complete shambles. That's what I'll say.
It's quite interesting, Doctor, that you are saying that. Let me quickly let you understand. 1.17 trillion naira was allocated to the health sector in 2023, 826.9 billion naira in 2022, 547 billion naira was allocated to the health sector in 2021. So we see a huge amount, well, in my own opinion anyway, in terms of what has been allocated to the health sector. So is the issue with funding, or what are the issues surrounding the state of health in the country that you have described as deplorable?
Okay, so let's understand. Nigeria is a country with over 200 million people. What percentage of the budget has gone into other sectors of the economy? And is health supposed to be, one of those very little areas that gets some amounts? What percentage of the budget goes into health? That is what we're looking at. And if, let's say, 2020 some budget was released for health and we are in an abysmal state, and 2021, 2022, 2023, we are calling big figures, why is it not reflecting? So it's not for government to say we have allocated this amount to the health sector. Is why are we not seeing this reflect? Because nothing is reflecting. It's very good that they are saying on paper 2-point-something trillion, this billion, that billion has been allocated to health. But why are we in a health sector crisis if such amount has been allocated? How much does it take to renovate all the primary healthcare centers in each of the states, in each local government? So what are we saying? Is this money really allocated, or is it disbursed at all? That is one thing that we also have to address. It's one thing for it to be on paper, is another thing for us to actually see this being implemented. And I'll tell you for a fact, nothing is being implemented. There's nothing you want to tell me. We're a country of over 200 million people. And from the data of the NDC, and there's barely any up to 200,000 registered doctors since the inception of the council. So what are we saying that such and such billion has been allocated? Allocated for who? To the hospitals, to developing infrastructure. What are they saying?
I understand, Doctor. So, of course, you're a medical practitioner and your opinion counts. What urgent interventions would you now say are needed to address the issues in the health sector?
I think at this point we are all sounding like a broken record, right? We're just repeating the same thing over and over again. What should we do? We know what to do. We know exactly what to do. We know exactly how to monitor that the money that has been released is being effected and is being implemented and being used in the areas that it's supposed to. So if you're asking me what I would do, the health sector, the Minister of Health, they know exactly what to do. The Medical and Dental Council, that is a regulatory body, the bodies of medical practitioners, dental and medical practitioners, they know exactly what to do. Labor unions, they know exactly what to do. So I feel that asking what should we do, what urgent intervention, general intervention is number one for these supposed allocated money to be used in the places that they are supposed to be used. They should remove this money from the hands of of these people that are not using it well. Go directly to these hospitals, find out the needs, implement these things. So if you're asking what urgent intervention, we are past the level of urgency. We are in a crisis. We're in a very serious crisis. So it you 1.7 trillion, 1.7 billion. Therefore, you cannot complain that you are still in shambles. The money is not reflecting. They're asking me what are we supposed to do? What urgent intervention? I don't know what urgent intervention. The money that has been released to be used in different in the health sector, the money should be used. See this meeting of health sector, see the entire meeting they are having the 64th Council Assembly. See how robust it is. Can we speak to the budget that they used to draw up just this meeting to have statesmen and stakeholders gather just to talk about the problem that everybody already is aware about? How much did it cost them to pull this out? Invite press, pay press, pay building, and all of that just to talk. I'm tired of talking, and asking me what urgent intervention we need is still going around the same issue of let's just keep talking. I'm tired of talking.
Well,
and so unless maybe the issue starts affecting everybody, maybe something else be done more seriously than just talking. The health minister knows exactly what to do. The health commissioners in each state, they know exactly what to do. You're asking me the wrong question.
Well, Dr. Bright, Oris-Ohwerhi, of course, at this time, one would have expected that the medical practitioners and their associations, both in the public and the private sector, would put more pressure on the Nigerian government and see how funds can be allocated to improve the health sector in the country. But then we'll continue to probe that particular discussion. Thank you so much for talking to us.